Anneberg Media.
With additional support from EQUICOR Equitable HCA Corporation, the Good Listening Employee Benefits Company.
We do not all start life on an even playing field. But the rules are that we all play it by the rules of honesty and ethics.
Before I took that case, I had to agree that I would do anything ethical to defend that man.
So I'm going to just do the best I can. Is it imperfect? You bet. Is it awful? Well, maybe so.
Isn't there a point in a civilized society where one man has to be willing to step outside the system and say, no, I cannot do this because it's wrong?
I think we're at that point, which is nice in the sense, ethically, where we don't have the rules to protect us. We have to agonize with ourselves and our conscience.
A long, long time ago, when my youngest son, David, was about 6 years old, a guest asked with a smile whether he really knew what a conscience was. Yes, David replied, it's that little voice inside my head that says, go brush your teeth. That's a pretty good definition of a conscience. A little voice inside our head that tells us right from wrong. When there are no laws and no rules to tell us what to do, we have to let our consciences be our guide. But in the practice of medicine, doctors can't always do that. Conventional wisdom holds the doctor knows best. Doctors, after all, are trained professionals. But today we have learned as patients to question our physicians' paternalistic decisions. That conflict between the doctor's paternalism on the one hand and the patient's autonomy on the other can reach fever pitch in the fast-moving world of modern medicine. Patients, and sometimes the courts, prevent a doctor from always following the dictates of her or his conscience. Are physicians obligated to respect our wishes even when we make what the physician thinks is a bad choice? Who will decide when doctor and patient disagree? The moderator of this hypothetical case study on that subject is Arthur Miller.
Dr. Coop, this morning you've made a special appointment with a longtime friend and patient. Betty Bright is her name. You've been treating her since she was a kid. And a couple of days ago, she came in for a general checkup. You did a pap smear. And as you're sitting there this morning, you're worried. It came out positive. And you're thinking about what to do. Here's Betty Bright. Hi, Uncle Check.
Hi, Betty. You look great. How are things?
Just got a minute. I got a film crew downstairs. You know, I've become a television producer, and we got to catch plane to Arkansas.
I'm going to have to ask you to postpone that for a little bit. Remember the test I did on you last week called a pap smear? It's a little suspicious. And when I say suspicious, it means some of those cells have things we call mitoses in them. Could mean that you have a very early cancer, and we can't afford... Cancer, Betty. We're not going to mince words. You know I'm a straight shooter. And when you have cancer, your life could be at stake, much more important than TV shows in Arkansas.
I'll be back in 2 days.
That's not a no. Not with me. We're going to go right down and see Dr. Hegner. She's an expert.
How about tomorrow morning?
Nope. You know me. You couldn't, if I give you a half a day, you can't get to Arkansas and back. So let's cut out and go down and see her right now.
Suppose she convinces you. 2 days.
That's hard.
She'll be back.
Okay.
Dr. Hegner, your buddy, Coop, has called, made the appointment. She doesn't show up. What do you do?
I'd know about it because my staff would tell me that, and I'd call Dr. Coop.
Talk to each other.
Betty Bright didn't show up for her appointment. I'm concerned it's 2 weeks later now, and I have left messages.
You think I scared her? I'm forthright about it, and I've known her. I delivered her. And we've always gotten along fine. Never pulled punches with her before, but I said her pap smear might be malignant. And I told her she shouldn't go to Arkansas. And I told her she ought to see you. Let me give her a call.
Good.
Betty?
Sorry, she's out of town again.
Is Betty married?
Yes? Let me tell you about her husband. He's a golfing buddy of yours.
Why didn't I remember that?
You gonna call him up?
Mm-hmm, I am. Only because I'm their friend as well as their family doctor, and I don't think it's an invasion of my patient's privacy. We live in a small town. Okay. What's your name?
Dan.
Dan. Dan, I'm delighted that Betty is so popular and is being taken all over the country, but you know, I found something we ought to pursue medically and maybe even surgically, and she's not returning our calls. I'm scared about her, or I wouldn't be making
Now
this.
you got me scared.
I hope you are, Dan. Wherever she is, get hold of her, bring her back, and let's get down to the medical center.
I get it. You think she may have cancer.
Cancer? That's exactly what I told her.
Dr. Galen? Has he done anything wrong?
No, I don't think so. I think he's been...
This is an historic
historic moment.
This is old Doc Coop we're talking about,
is
not
Doc
Surgeon General Coop. No, old Doc Coop rarely does things wrong. Admiral Coop is another story. No, I don't think so. I think I tend to be somewhat more hesitant. I don't like euphemisms. I think he has a right to use the word cancer. I think he knew her well. I think he did a nice direct approach.
Who's his patient?
His patient is Betty, and you're worried about calling the husband. Is that it? I have a feeling that the concept of privacy amongst physician and patient is almost sacred.
Almost.
Yes, there's very little that's really...
Almost.
That's right. Very little that's really sacred. He's frightened. He's a friend. This is his patient. She's behaving irrationally to a certain extent.
Irrationally?
Yes, a young woman doesn't want to die. And she's taking a time bomb event and playing games with it. So he recognizes that maybe he was too blunt. And he knew that he may have pushed that word cancer too fast, too quickly, but he presumed on the friendship. So he's worried, and I think he has a right
to talk to the husband.
Yes, I do.
Dr. Young? Should Dr. Coop have talked to Betty's husband?
Absolutely. I believe that if he didn't, he would have betrayed the confidence of friendship that he's had with his family over the years.
What about his doctor-patient confidence?
The doctor-patient confidence is a trust and an important one, but first comes the well-being of the patient.
By the way?
It's bilateral.
Is it?
I believe so.
It's not mine?
No, it's not yours.
It's not mine?
Not solely. Because I've assumed, as your physician, part responsibility, part partnership. Not yours alone.
Mr. Capron? Has there been a violation of doctor-patient here?
Yes. No question about it.
I mean, these are well-meaning folk.
They are.
But it's my privilege. It's my confidentiality.
It is indeed.
What are they doing wrong?
They're breaching it. They're deciding what's in your best interest.
But her life is on the line.
Life is on the line, but it is her life. That's the point.
I sense you're troubled by this.
Yes, Mrs. Bright is a grown-up, and she should be treated as a grown-up. And I'm disturbed by all of this paternalism that I'm hearing here. There are many explanations for her not returning the call. She could be going through a particularly busy point in her life. She could know very well that 2 weeks isn't going to make the difference between life and death. She could be digesting this information before she speaks with her husband. And finally, contrary to Dr. Galen's speculations, it could be that the C word wasn't pushed hard enough. That she has a friend, Mrs. Not So Bright, who had a pap smear and it turned out to merely be cervicitis. And Dr. Coop, or Uncle Chick, hasn't told her that this is serious business. Now, I would suggest that he try harder to get her in the middle of the night at the hotel where she's staying.
He's tried. And you get that call from the husband. And it's clear to you that Betty is lying to Dan. Betty told Dan, got a clean bill.
That's Betty's business. If she wants to lie it down, that's Betty's business.
It's Betty's business?
That's right.
Even though psychiatrically or psychologically what's happening is she's incapable of facing it.
Well, that's Dr. Galen's inference. I think lying to your husband doesn't mean that you're psychotic.
It happens all the time.
That's right, it happens all the time.
Dr. Hegner, I have some good news and some bad news for you. Betty has appeared. She's in your office. The bad news is all the tests show it's cervical cancer. Early stages. What you doctors, I'm told, call stage 1A. You're convinced, you're absolutely convinced that the appropriate, proper, really only effective treatment is radiotherapy. What do you say to Betty?
If it were a stage 1A cancer, radiotherapy would not be the only choice, and I would explore the alternatives with her. There may be a stage 1A cancer that I feel as a radiation oncologist, radiation therapy would be the best modality of treatment.
You do.
And I would tell her that.
She says to you, well, I guess I have to start digesting this. I hear what you're saying about radiotherapy, but I want to know what all the possibilities are for my treatment, and would you please give me a couple of textbooks? I'd like a reading list, and then we'll talk. How do you react?
I think I like that very, very much.
You like it?
Yes.
Why?
Because she's showing an interest in her disease, and we're going to act as a team to treat it.
Now remember, you are absolutely convinced radiotherapy. And she walks into your office about a week later saying, I've read this stuff. I want a radical hysterectomy. Mm-hmm. There's one thing I've learned being a television producer. You have to attack a problem.
Get it out.
Get it out. Just get it out. I can't fool around with this. Appointments for radiotherapy. Out! Okay?
Yes, that's her choice. I would go over with her what she read to make sure she understood the technicalities. And then if she still said that, I would try to refer her to the best oncological surgeon that I knew and let him or her decide.
She's vetoed your professional judgment. Now you sit there happy as a clam. That doesn't bother you?
It bothers me, but it's her choice. It's her body, it's her choice. And she has to live with the consequences of the choice.
The hell with her.
I don't think I said the hell with her when I took the time to go over the
But if you really care about this human being and you're morally, ethically, professionally certain she's made a wrong decision, why are you sitting there like a lumpkin?
Because it's her choice, it's her body, and she has to reap the consequences of that choice.
Mm-hmm. What are you gritting about?
I suspect that she's made the choice on the basis of the side effects of therapy. Dr. Hegner is a very good radiotherapist and has told her truthfully this is one of those rare cases in medicine where the two therapeutic outcomes are absolutely identical, and there's hardly any argument about that. So you deal with it on the basis of whether you want side effects of radiotherapy or the side effects of surgery.
Dr. Galen?
Well, I understand the respect for autonomy, but I try to think of this case a little slightly different. The whole idea of carrying it to the point of saying it's her body, whatever she wants to do with it, I'll do it, seems a denial of the fact that as a physician, I don't serve your desires. I serve a concept called health, and I serve your needs. Supposing that she didn't have, supposing she had a negative biopsy, but she was scared by the pap smear, and she said, I want to take it all out, I'm a nervous person.
It may come to that. What I hear you saying is they're denying their own autonomy. Well, catering to her autonomy.
I think that they're taking a peculiar attitude, an autonomy-led attitude about their professional duties to do. Now, I'm not clear. These are two pros on operations, but I'm going to take the fact that the radical hysterectomy is really not an indication, is not indicated at all. And I'm not at all clear why Betty wants to do that. As a psychiatrist, I'm worried about that, but I'll even let that go by. But I am somewhat disturbed by the readiness of physicians to say that you serve your patient's desires rather than their needs. And if she insisted she didn't want the radiology, I'm not going to strap her and have her do it, but I'll be damned if I'll unnecessarily remove her uterus and every other part of her
body.
Well, it's her body, but I'm a physician. well, then what is my professional responsibility? To deform her?
So you won't do it?
Of course I wouldn't do it.
You
It would
won't
be unethical.
do it. She walks out the door.
I would tell her that I can't ethically do something.
You know
which is
what's going to happen if she goes out the door?
She'll find an unethical doctor who'll do it.
She's going to see no one. She's going to die without any treatment.
I still would not violate her body for some imaginary anxiety of hers. That would be, it seems to me, a violation of my commitment to this religion called health.
Let me change the story. Let's go back to the point when Betty Bright first comes into your office following the test. Cervical cancer. 2A, advanced. It's more advanced. And Betty Bright is now into her 14th week of pregnancy. What do you say to her?
It's what she says to me first that I would zero in on. How did she find out she was pregnant? And the 14 weeks, has she gone to a gynecologist?
Yes. And it's all confirmed. There's no question about that. It's... What are my options, doctor? What are my options?
Well, you need treatment for your 2A cancer. And this time it is definitely a radiotherapeutic problem. And you need it as soon as possible. We should start. It's not an emergency, but we should.
What will that do to the fetus?
It will abort the fetus eventually because you'll interfere with the ovarian.
You mean I
function.
have to give up the baby?
You would, yes, you would.
And there's a good chance I'm going to die.
No, not with 2A. We still are talking about a 60% survival.
That's a good chance. 40% is a good chance I'm going to die.
Mm-hmm.
I don't think I want to give up the baby. It's a gift from God. It's all Dan will have left. I've never beaten the odds in most things I've done. I don't want to get morbid about it, but I think I want to save the baby.
I can respect that and understand that. I would want to call my oncology colleagues and see if there's any alternatives that we could bring to you that would still allow you to have the baby.
Maybe I should think about it for a day.
Yeah,
right?
we don't have enough information. We need more information, both of us, you and
Uncle Chick, they tell me I've got advanced cervical cancer. I want to save the baby. Am I crazy for saving the baby?
Betty, I know how you feel about these things. I know how Dan feels about it. I know he's always wanted to be a father. And in the ultimate, it is your decision. I have to tell you, Betty, that I don't know as much about this as I'd like to. And I think we ought to talk to a number of people. There's Dr. Stallman, who knows about survival of babies. There's Dr. DeVita, who can tell us whether or not we're risking your life a lot more by letting you carry the baby to a point where it could be taken by cesarean, and Dr. Stallman could do it. I want to hear their opinions about that. And then I think when you have all that information, you've got to decide what you want to do. But I think you've got to decide whether the benefit of having this baby and leaving something for Dan, as you put it, is worth the additional risk of keeping the baby and postponing treatment for those 10 weeks. And I'm just not smart enough to know all the odds about that, and that's why we have to go down to
suppose it all comes back that, yeah, I'm really increasing the risks if I don't do the radiotherapy. I'm almost committing suicide. And I'm asking you, Uncle Chick, since my parents are long since gone and Dan's a basket case over this, what you would advise.
Well, if we proceed with the treatment that's been suggested, you're going to lose the baby. I think you've got to decide in the long run, and I think you ought to have some counseling, maybe some psychiatric help, maybe some pastoral counseling, on whether Dan really wants that baby as much as he wants you. And I don't think you just ought to jump in and have a romantic notion that I'm giving up my life for my child, but Dan will have a child. I'm not sure that's what Dan wants, and I think you ought to discuss it with him, and I think you need some help.
Dr. Galen, what would you advise? Dan does want the child, but he's sort of...
I'm not concerned with Dan at this point. I am concerned with Betty. And I would certainly talk to her and express that concern. It's not strange to me. It's an emotion that I can identify with, and I use my own emotions. That if I thought that I were going to die, I don't believe in God particularly, that I have this piece of immortality within me, it would not be strange to me if I felt that there were a reasonable chance to die to prefer to leave a child to Dan, whom presumably I loved. So I won't make any a priori assumptions that this is a crazy decision. I think we're at that point, which is nice in the sense, ethically, where we don't have the rules to protect us. We have to agonize with ourselves and our conscience. And I can't say that life is worth more, and she may have a very bad life, and she may not have a life, and we're up to the 50-50 point. So I would have a high respect for Betty's opinion on this, and give her, and I am someone who is very paternalistic, as you know. Here is where I would give her an absolute autonomy. I have no real preferences in this until I've talked to her, and if she tells me some things where I get some indication that something else is going on, that's another story.
I've thought about it, Dr. Rosen. I want to save the baby. Am I crazy?
Absolutely not. This is a very appropriate decision at this point in time.
You'll work with me?
I'll do the best that I can.
Can we have a partnership?
To the best that we can get along.
We'll save the baby together?
We'll do our best.
Remember, baby first, me second.
If that is your wish, and it is a reasonable wish and a reasonable choice, I still reserve occasionally the right to individualize my care, but I will work with you. That's my role at this time.
Dr. Stallman, your colleague, are you with him?
Absolutely. I think the responsibility of the obstetrician, who would be the one that would be taking this responsibility at that time, is for two lives. There's an unknown life, which is the baby. There's a known life, which is the mother. And if she knowingly makes the decision that she will take the chance that her baby will go to viability, then I think that is her choice.
Time moves on. Betty's condition worsens, worsens, worsens. She's near death. She's near death. She's in her 28th week of pregnancy. Dr. Rosen.
I'm on vacation.
One day Dan comes to see you. Doc, I know she's dying, and I know it soon, and it's killing me. I've loved her since the day we met. It's been a great, great marriage. I can't stand to think that not only will I lose her, but I might lose that baby. Can't we do anything?
I think we have to be clear that we understand the medical situation. Let us define it clearly. Let us say in 2 days this patient will die.
Or 4 days.
Or 4 days, but not much longer, because a week or more provides different help for the baby. And this baby may live. In this individual case, I would say, what are the risks to one of my patients, the mother? The risks are very small. She is going to die, and the operation is not going to change it. What are the risks to my second patient? The patient will either live or die. I think now I have a very difficult choice. I think I may choose to try in as many ways as I can to convince the mother clearly to deliver the child And at that point, I may ask help from others around me to make the next decision.
Cesarean section.
That's the only way this baby may live, and I am fixed with a very difficult decision. I want the child to live.
It's your decision.
I am one of the decision makers.
Well, I'm Dan, and I think it's a great idea. I agree with Betty. This is a chance to preserve a piece of her, and I can have a piece of her. What do we do now? Do I have to sign a form?
You have to do more than that. We have to get some help from other support personnel to try and change her opinion. And then we have to try and work within our legal system to try and say, is there another reason for which we remove a patient's right, and what is the greater harm?
So you'll go see her?
Oh, I'll go see her.
What do you say to her?
You're dying. There is little more that I can do for you. I can save your child. I want to save your child.
Simple as that?
It's not simple. It's very difficult.
Hasn't Betty already agreed to subordinate her life to the fetus's life? Wasn't that established?
I can hang on. I can hang on. I want to hang on, Doctor.
I need some help. I would like to make the decision knowing that at this point I am taking away the responsibilities and the obligations of a patient. I'm destroying the partnership that I've tried to live with and can almost always live with. But now I have my obligations and responsibilities as a physician too. What can or can't I do? If I remain the doctor, I have to find a way to deliver this child.
I can hang on, Doctor.
You're dying.
You don't know how tough I can be.
I understand your feelings. I'll try and help you in any way I can, but you're dying.
Can you guarantee that my baby will be born healthy?
In this world, there are no guarantees, except the way we leave it. And I cannot give you that guarantee, except that I can give you the guarantee I'll do the best that I can. And that's my obligation for you.
But you know the longer we wait, the better the chance is for that baby.
My judgment is fallible. I'm not godlike. I do the best that I can with the information that I have. I believe I am right. I am relatively certain that I am right in this case with all the information. But I am fallible as a human being.
And what's that operation going to do to me?
Very little. Your life is in terms of days. It may do something remarkable for you. It may give you an opportunity to see your child before you die.
Ooh, you're pulling the real emotional strings, aren't you?
That's right. I think I have some roles in here, and somewhere in my head I have to weigh the scales of the greater harm and the greater good.
And would you let Dan talk to her?
He should be part of this.
Tell her how he yearns to have that baby every day of his life, to remind him of her, and it's the only way she can live on is through the child.
It's part of the scene. We are sometimes objective, and sometimes we're less than objective. We have roles to play, and we have to believe in some of those roles.
This is not a neutral role, I'm hearing.
If this patient in the beginning had chosen to seek no medical care, I would have supported her in that set of circumstances. It would have been her right, but it was a different situation. And now we have two people to consider.
Two people?
Whose rights do I violate now?
You're quite correct. It was my choice. Now, by pulling my emotional cords, you and Dan are pushing me into a decision that I might not want. Ms. Waddleton, how do you react to this?
I react that they are intervening inappropriately when it is becoming increasingly more difficult for the physician with respect to his or her role, or his role as it has been described. once the paternalism stopped around getting her in for treatment and the partnership was established, I think that the medical profession has an obligation to continue that partnership.
But he says he's got 2 patients.
I think that he entered a covenant with this patient, the woman whose will he was willing to accept and her judgment he was willing to accept. He can't turn the tables at this point.
Ms. Goodman?
Well, I am far less than convinced that the doctor's prognosis for, may she be my daughter now, for my pregnant daughter, is accurate. She suggests that she feels this tremendous will, and all of her motives are to stay alive until her fetus is 30 weeks, which gives it significantly better shot at a healthy, normal life. I'm not at all convinced that the doctor has a direct line to God in this situation and can tell me how many days. And I would say that my daughter has gone this far in her pregnancy and in maintaining this because she wants not a child who's going to end up severely deformed or dead.
These are the pros.
Well, pros, schmoes.
You're rolling the dice.
My sense of proness in this circumstance.
I mean, you're a great wordsmith, but what do you know about test tubes and things like that? You're rolling the dice.
There are parameters that I don't think they know. I'm not an expert on it, but I'm less than impressed with their expertise.
So what would you have done in this case?
In this case...
Would you say he can't voice his opinion? He can't go see her?
No. I have no problem with moral pressure or with all of them, although I did have some problem with his private relationship with Dan. I was beginning to think that Dan was the pregnant one for a while there.
It's a team effort, you say. It's a big partnership.
I would let it ride. I would let her have another day. And let her have another day.
Oh, you're just temporizing.
Well, that's what we're into here. We're into temporizing. We're into a very careful balance.
They got the pen in her hand for the consent form.
But she doesn't want to sign the consent form.
Well, we don't know yet. Do you want equal time?
All I'm doing as her mother is listening to her and supporting her. And probably as her mother, I have a high motivation for her to live that extra day, 2 days. But I also know that what she has wanted, clearly, she's made a decision from the front end of this, that she wants the baby to live whatever happens to her. And she and that baby have a partnership towards survival. And they see that partnership differently than the doctor does. And at this moment, I'm on my daughter's side.
Dr. Rosen, they say you're playing God.
They can say what they like. They've changed the rules on me. Now, what is going to happen to this patient, your daughter, is that today she can give us a decision. We will make a day-to-day decision as to the best we know. Tomorrow, she may no longer be able to give us this decision anymore. We need to know now, because soon you're going to leave me, as well as yourself, sitting at the bedside, and nobody will make a decision. Someone may have to make it.
Well, she says no. I know you've got my best interest. I know you've got the baby's best interest. No, I'm going to hang on. What do you do now?
I cry inside, and I'm not sure what I do externally. I know what I've done in the past, because society hasn't helped me in this set of circumstances, and so I have to individualize care. What would I like to do? I would like to take this patient to the operating room today and deliver the baby, because that is the better good. What will I do when the next case like this comes along again? I'll sit at the bedside and make the decision. The last time I had to do this, I had to wait until the patient died. And then the baby died also, although it was delivered by a post-mortem cesarean section. And I was faced with the ethical issue. I finally had to ask myself and learn a new stance. Who speaks for the fetus when the fetus has a right?
But if she says no to you, the most you're going to do is sit at the bedside.
No, I will try through administrative processes and through the law, despite the fact that the American College of Obstetrics and Gynecology says I should not. I will try to find through every way a mechanism for delivering this child. And then in the end, if someone will share some of this responsibility with me, I will do this cesarean section.
Mr. Hospital Administrator, he comes to you. Says, I want to take this baby out. But she says no.
I think my position would be that the patient right now is the determining factor, and that we have to go with her to the best of our ability. And I think that it is a situation where we face a potential of a double tragedy, but I think that right now she's lucid, she's very certain about what she wants, and I think that she has certainly been explained and seems to understand the dangers she faces. I don't see how you, at this point, can override her will.
Mr. Counsel?
I think you've got a very tough case. I think to try and say that the fetus has some rights at this stage when the mother is lucid, and I think actually either choice the mother makes, to continue to without having the cesarean or to have the cesarean, is supportable. And I don't think, I mean, if the hospital administrator and the doctor come to me, I say, we could try, but I don't think we have much of a chance of winning an argument.
You're flexible, like a good lawyer.
Well, I think they're likely to get sued, whatever they do, as time goes on.
As you suspected, she slips into a coma. And Dan is pounding on your desk. Here's the consent form. I've signed it. Do it.
Society hasn't protected me in this very unusual case of two people in the patient-physician relationship, and it is not well defined. At that point, with his signature, I believe I would go ahead and do this.
Do it.
The mother is dying. However, before I do it, I want to be sure that he understands the risks and the benefits of this procedure. The benefit is we may have a surviving child who will be a perfectly normal and healthy human being. I cannot promise you that this will be a perfect child. I expect it will be a healthy child. You and I are sharing the responsibility, and you will raise that child, and there is a new part of this question. Therefore, if you are assuming, Dan, some of the responsibilities, I will assume some of them with you, knowing full well that after this is finished, our lives are going to be much more complicated.
You would take the piece of paper and go to the operating room and do it?
I think I would, at the point that the child had a good chance of surviving and that the risk for Mrs. Bright was negligible. It was gone. If we're going to argue the law against a life, then I think the law, too, has imperfections and may have to recognize some of these circumstances.
You think he's doing the right thing?
One can argue that he's doing exactly the right thing. I think what has been left out of this conversation is that this baby is not one person's baby, it's two people's baby. And that the father has got responsibility. The fact that he hasn't carried this baby within his body doesn't relieve him from the overall responsibility for it. He will be left with the total nurture of this baby. And so I think that all of the conversation so far has excluded him as a person with rights as far as this baby is concerned and decision-making as far as the baby is concerned. Now, there are two or three things that I think have been perhaps overlooked as this scenario has been played out. And one is that the uterus is no longer a black box. And one can, with very sophisticated techniques, as Dr. Rosen knows, evaluate the well-being of this fetus in utero on an hourly, daily basis. And the decision as to whether or not the fetus is suffering because of the mother's illness and is likely to die in utero as a result of it can be evaluated really with some confidence.
And if that is a real possibility?
If the baby is dying as well as the mother dying, and there's a chance to save the baby's life, I'm the baby's advocate. I must be the baby's advocate.
Dr. Marks, do you think you should just let him do his thing? You want to talk to counsel?
I certainly would talk to counsel.
Your advice?
I think Dr. Rosen is now very much playing God. Maybe that's what he's got to do.
He's heading for the surgery. What do you think should be done at this point?
I think that I am prepared to defend Dr. Rosen and the hospital, whether he heads for surgery or doesn't head for surgery. I think it's a situation in which either decision
would you like a court order?
Supportable. I'd love to have a court order.
There's the man with a writ in his pocket.
Well, I would go to the judge and I'd say, we have the situation in which this woman has slipped into a coma. All the medical evidence indicates that this will be a healthy, viable baby if it can be delivered by cesarean. The medical evidence also indicates that a cesarean is likely to kill this woman, although at best she's going to die anyway within a few days. We would like the father of the child wants the child born, believes that the operation should be performed, and we would like a court order blessing affirming the father's decision and protecting Dr. Rosen.
Now, I know you're one of the fastest judges in the United States, but you're going to have to listen to the other side.
I'm trying to figure out how I can say there's no jurisdiction here.
Ms. Capron, you're arguing the other side.
I want to oppose the motion that the judge is asked to make the decision for the patient. The judge might be asked who can make that decision, but there's no reason for the judge to make it. We face a big problem knowing what Betty wanted here, really, because if her determination from the time at the 14th week that she was told she had the cancer and was pregnant was to risk her own life so that baby could be born, I agree with everyone who said we need some preventive law here, not just preventive medicine. We need to have had these discussions more clearly with anticipation of what was the probable outcome if you, as you're putting it, temporize. It's a question of negotiating with the patient. Can I give you one more day? Maybe Dr. Stallman will say it's even better for the baby. Dr. Rosen, think it's a little bit worse, but there's medical disagreement. Now, if Betty's mother says, she and I had a good discussion about this, and in the end she felt, I don't want this baby to be born. After all, I'm too worried about the risk, and the mother now is in court. I'll represent the mother. And
what will you say to the judge?
I'll say the mother is a better representative of her daughter than the husband. He is talking about his own wishes here to have this baby. It is her body. She may be comatose, but her wishes should still prevail in this situation.
Ms. Waddleton, you want to file an amicus brief?
Yes, on his side as an advocate of the mother, yes, because I believe that the physician has an obligation to honor the woman's decision. You have to look at what has happened from 14 weeks to 30-some weeks.
It's been a roller coaster.
Well, it seems that she has been very consistent, however, that she wanted to maintain this pregnancy until the fetus was viable and not to interrupt the advancement of the pregnancy until the very best possible odds could be made for fetal survival.
And the conversation with her mother on the eve of the coma was, I want to wait I want to wait.
But I assume that she wanted to wait because she was speaking in support of advancing viability, not that she did not want to ultimately have a cesarean section, because
Does it make a difference?
I assume that Dr. Rosen has already advised her that it is likely that if she wants to advance viability...
Why don't you question counsel?
Well, what's disturbing me now is everybody is talking about the father's rights and the mother's rights. I haven't heard anybody speak of the rights of the fetus.
I have.
You did,
I'm the
Doctor.
fetus advocate.
Well, good. I've got one witness in whom I have the utmost confidence. But it's not anything that ought to be in the court. There isn't any question. There ought to be some legislation.
Judge, render an opinion without footnotes.
I think the state has an interest. I think a state has an interest, and I would say, doctor, go ahead and take the baby.
A little psychiatric testimony here?
No, not psychiatric. We do have another principle that we haven't mentioned. We mentioned autonomy, that she has a right, and I would not have her have the operation against her will. But Betty is not a case history. She's a human being, and there is a concept of authenticity. There is a lifetime that we have. This is not some strange woman. This is a woman who made a tremendously courageous, whether it was wise or foolish is independent of my judgment, statement that she wanted this child to live. Often, beyond Betty, we have people at the older ages of life where we're not sure what to do with limited autonomy. And what we look at is what we call authenticity, the concept of what is this person. It's not a mystery. Her mother knows her. Her obstetrician knows her. I, as her psychiatrist, have known her. And we've seen a consistency of dedication to that child. And I'm willing to supplement, without the courts, the autonomy expressed of this woman after she's passed into a coma, the proxy consent or the consent of the husband, with my knowledge that this is an authentic action consistent with the Betty we all knew and worked with over all these weeks.
So we're all working to do what Betty would have done. Is that what you're doing, Judge?
Well, you've made it easy. I know what you're going to do to me now. Go, do it.
Let's tinker a bit. Let us say that she did more or less change her mind. She found the pain intense over time. She was fairly clear in the last few days. No surgery, no surgery, no surgery.
Give me some evidence.
Give you some evidence. Mother has to fess up that that's what she did say. Dan is, of course, saying, oh, that's just the pain speaking. That's just the pain speaking. We're now in the 29th week.
Let me hear from the doctor, too.
Dr. Rosen?
Can you save the baby?
Yes, we can save the baby. However, I have difficulty with the fact that the law says to me, one day, when I can hold a child in my hand, the same person, I must do everything that I can as a physician to protect the child's rights. And the next day, because it's in a shell within a body, I am violating one person's rights to protect another person's rights. I can save the child if we deliver it today. I violate my patient's rights, but who is my patient? I think today I have to speak for the fetus. Yesterday, I may have spoken for the mother.
How did you make that transition, Dr. Rosen? Because certainly back at week 14, you were able very clearly to make the distinction that the patient was the mother.
Not easily, you're right. At day 14, I had no choice.
But on what basis did you make that
inside,
transition?
On the fact that one would live and one would die at one stage, and a second person will live and a second person will die at the other stage.
But how do you know that she will absolutely die? We've got the Karen Ann Quinlans of the world, in which all medical science with great precision said that if she were removed from life support systems, she would die immediately, and did not. Aren't you really going beyond the capacity of medical science to make a determination and an intervention against her will?
I'm not God, and I'm not perfect. You're quite right. I must do the best that I think I can. Today, this is the best that I think I can do. Give me more information. Give me
Let me
help.
add, Dr. Angel, what would you say to the judge?
I think it's less important what the decision is than who makes the decision. And you've suddenly made a sharp switch in this scenario. Before that, we had Dan and Betty united in wanting the survival of the fetus. And the only issue was how best to ensure that survival. And according to that scenario, as soon as Betty becomes comatose, then the husband, Dan, is the natural person to sign the consent form. And I would say to Dr. Rosen, go ahead, and I wouldn't bother Judge Marriage with it at all. But now you've changed it in a crucial way. You've said that Betty does not want the cesarean. I have no idea why this is, and I'm not sure that I have to know why, as long as she understands the nature of the decision and the consequences, as long as she is a competent adult. And then I would have to honor her wishes, and I would have to assume that her husband would carry out her wishes as well, that in his judgments from the moment she becomes comatose, he's exercising what's called substituted judgment. That is, making his decisions on the basis of what she would want according to her right to self-determination, which should be paramount.
Judge?
Tough decision. They all are. Sorry it's here, but I've got to, the evidence before me is that we have a viable fetus here. It's not just a fetus as at the moment of conception. There may be an argument there too, but in any event, that child can live outside of the mother. The doctor says that the mother is in terminal condition. I would say go, doctor, just as quickly as you can and save that baby.
One more turn of events. Dan, in the last 24 hours, has become absolutely convinced that Mother and Ms. Waddleton are right. Autonomy is the key. And he says, let nature take its course. And frankly, I don't think I can bring the baby up. I just don't think I can.
We have a doting grandmother just waiting here.
Your ruling?
Same thing. Same thing.
Despite the fact that abortions throughout pregnancy are legal to save the health or the life of the mother, and it would certainly affect her health.
The evidence before me is that this woman is dying, that you know, I realize the doctor isn't God, judges aren't gods either, but cases have got to be decided on the evidence that's before the court, and the evidence here is that this poor woman
is dying.
Is going to die in a day or two.
The judge was clear. Let's really ratchet it up. She was clear before going comatose, no surgery.
That's correct.
And Dan has fled the field. Your partner has bugged out. Are you going to raise the baby?
I wish I didn't go into obstetrics at this point. I have to live within my own head, and my procedure here would be that if I can get some backing and some support, I'm going to try and deliver that child. If you won't give me any help, I will do what I have had to do in the past.
I've done
I will
everything
walk
to
away.
go in the room with you. I told you to do it.
But were it to occur that I couldn't get some support, then I find that there are only so many windmills and so many risks that I can undertake, and I'll walk away from this in sadness, feeling that I was wrong. But if you give me some help, I will deliver this
grandmother.
patient. No, I need the law.
You need a writ.
I need some support, because I know that I'm going to be back in the courtroom after this child is delivered. And I know that this case isn't going to end today. Tomorrow there will be another one. I need some help or I'm totally destroyed. I'm a human being, just as we all are.
What happened to Betty's autonomy?
And what happened to her rights? Did they slip into the coma with her?
She doesn't have all of that autonomy when it involves a third person, an innocent person.
If she were awake, you'd never subject her to the surgery. Did she lose her rights simply because she became comatose?
Well, somebody has to speak for her, and unfortunately, they've chosen to, well, he spoke from both sides. But be that as it may, somebody has got to do it, and they've left it to the courts, unfortunately, and we're the wrong organization to have it. It's these people that should be calling the shots.
I think that Dr. Rosen has been magnificent in carrying out a contract that he made under most extraordinary circumstances to do everything he could to satisfy her wishes, which stayed intact for 14 weeks. And all these new things are just things that have happened before her death.
But she has no right to change her mind. She has made an irrevocable contract with Dr. Rosen, and he is going to follow through on that no matter what the circumstances are?
Don't you find that a strange change of mind, knowing that this woman sacrificed a 60% chance of her life for that baby, and you're going to want, on what may be a whim or the terror of the moment, you're going to want to undo her sacrifice of her life for what principle?
Undo what she wants to do.
This is a person, we know
It may be
her.
strange. Human beings act strangely all the time. But in making that decision at week 14, does that mean that she has abrogated all capacity to make a different decision?
She didn't make it
as unwise as it may have been.
She made it at week 14, 14 one day, 14 2 day, 14
14 to 28. Does that mean that she has no further right to change her mind, to take a different course? Is she not still a part of the human race that has the right to make these decisions, and indeed as imperfectly as we are to change her mind?
Dr. Galen and Ms. Waddleton disagree in this agonizing conflict. They may both be right. Judge Merridge, in this case study, ordered the doctor to operate. In the real world, judges have ruled both ways. That leaves physicians and their patients without clear guidelines when patient autonomy clashes with the physician's traditional paternalism. Next week, the biography of a corporate takeover is plotted by T. Boone Pickens and Sir James Goldsmith as we explore ethics on the business battlefield.
This has been a production of Columbia University Seminars on Media and Society in association with WNET, New York. Columbia University Seminars on Media and Society is solely responsible for the content of this program. With additional support from EQUICOR Equitable HCA Corporation, the Good Listening Employee Benefits Company.
Anneberg Media. For information about this and other Anneberg Media programs, call 1-800-LEARNER and visit us at www.learner.org.